Hey guys, what's up? My name's Christian. I'm a pre-PA student. I applied to PA school back in March, and I'm going to be interviewing sometime in September to the end of this year. So today we're going to talk about what I'm doing to prepare for my interview for PA school and what I would have liked to change or do differently about my application when I applied. So I'll see you there. Guys, so the first thing I've been doing to prepare for my interview for physician assistant school is reading books. I got some of these books a while back because they give some information on the application process as well. They talk about the history of the PA profession and all that kind of stuff. So the books I have, from my least favorite to my favorite, would be first, hopefully this focuses, So You Want to Be a Physician. So this book also talks, it's primarily about getting into med school and all that, but it also talks about and is relevant to other professions. So what I like about this book is it's mostly about the interview, but it also talks about personal statements and general application questions, and it goes over the statistics of some of different professions. So my second book that I like is specifically geared towards physician assistant school, and it only focuses on the interview itself. And that is Physician Assistant School Interview Guide by Savannah Perry. What I like about this book is it has a very wide list of different questions you might see during the PA school interview. It has instructions on how to conduct a mock interview, which I think is really important. It has a master question list at the end. And as far as the beginning goes, when you go through the questions, Savannah does a very nice job of outlaying what you want to see, what the interviewing committee wants to see like your answer is. And it's not necessarily what they want to see, it's what you don't want to say. So if they ask you, for example, there's behavioral questions, and they ask you, if you won the lottery, what would you do? Would you still be a PA? You don't want to say I wouldn't be a PA. But anything else besides that goes. So you could say I would invest in real estate. I would put it into a fundraiser. I'd buy a car. You could say whatever you want. As long as you don't say I wouldn't want to be a PA anymore. I would go to med school. So I really like that she does that. She tells you what not to say and gives you suggestions of what to say. And then my favorite book of them all, this is a general guide of actually getting into PA school. So it goes over the history of the profession, getting a letter of recommendation, letters of recommendation, goes over the essay, goes over the statistics. It's just an overall guide for getting into PA school. And I think that if you want to get into PA school, you should get this book. I'm not sponsored in any way. I think everybody who wants to go into PA school should have this book. And that's Getting Into Physician Assistant School by Andrew Rodikin, who's also a PA. Now, the thing about this book is, with the other books, these people aren't on application committees. This person, Andrew, is in a application committee, and he has years of experience working with applicants, so he knows what he's talking about. And it definitely shows in the book. He does a very great job. And I think that if you were going to get just one book, it would be this book, and it would completely take you through everything. He also goes over a little bit about what to say and what not to say in the interview, but it's not as in detail as this one with Savannah Perry. But that is just because this is specifically focused on the interview. This has a decent amount of information on the interview, but the whole book is not just about the interview. So those are the books that I'm going over. I'm also going to be doing like mock interviews based off of the guide in here and the questions I got from all these books. I compiled a list of questions into a Word document, and I'm going to use all those different questions to have a mock interview or just like review them in general. And I'm not going to memorize my responses, it's just about thinking of experiences to refer to. So for example, if they ask you like what was a volunteer experience that you enjoyed, and off the top of your head you can't think of anything, that's going to look really bad on you. So it's just about recognizing what experiences are relevant to the PA school application. Another thing you want to do is get a list of the accomplishments, the environment, what facilities each school has that you're applying to. So like if they have like a special like anatomy lab, or if they have a really high pass rate, if they have a high graduation rate, if they have a low, what would it be? If they have a low teacher to student ratio, so like a small classroom size, if that's what you would prefer, which many people do, capitalize on that and really talk about why you want to be in that school and use specific examples. And that goes for each question. Use specific examples. You don't want to give cookie cutter answers, but you also don't want to give broad answers that don't actually show, answer the question adequately enough. So what I have in this document here, I made a little manila folder document about the PA profession, the specific PA program that I'm applying to. For you guys, it would be every single PA program you're applying to. Get information on the faculty, like know who is most likely going to be interviewing you, so you could ask personal questions to them, specific questions. The facilities, you want to review what past students are saying, like alumni or current PA students. You could either do this on their website, some might have. You do this on LinkedIn. If you shadow someone who's a graduate of the school that you're applying to, that would be great. Talk to them about it. You want to get their PANCE rates, the board exams, pass rates, graduation rates. There's another thing I wanted to... any kind of programs they have, like any medical mission trips that they have, any humanitarian aid stuff that they offer. Know the curriculum, know what an average day in that PA program would look like, know about any clubs they offer, and you could mention them specifically. So that's a great option. You want to focus specifically, especially on the 3 big questions, which would be, why do you want to be a PA? Those specific reasons, like say, maybe it's because of the lateral mobility. You could switch from specialty to specialty without going through a residency like a doctor would. Practicing the medical model versus the nursing model for an NP. Use specific stuff like that. Don't just say you want to help people. That's not what they want to hear at all. The second biggest one is tell me about yourself. Once again, use specific examples that are relevant to the PA profession. So volunteering, what you did for your patient care experience hours. You could mention a hobby that's relevant to your passion for medicine. So like for me, it could be hiking, and I always am prepared medically because I am interested in the future in emergency medicine. And then the third biggest question would be, why do you want to go to this program specifically? And that's what we just talked about. So that's pretty much going over all of what I did to prepare for my interview for PA school. Now I want to talk a little bit about what I would change in my actual application and what my stats were applying. So the biggest thing is, I think my essay, my personal statement, could come off as a little naive, because I did mention specific fields that I do want to go into as a PA, which, I don't have any experience as an admission committee, but from what I've read in these books and what I've heard is that PA programs are looking for someone who, is able to keep an open mind. And I think that by mentioning, specific specialties of what you want to do in the future, it's kind of having a closed mind. So I wouldn't recommend, and I would have changed that actually. You could have, I think what I would have liked to do is give a little bit more broad examples. Like I would like to work in inpatient versus outpatient. Like something like that that's not very specific and comes off as closed-minded. So that would honestly be the main thing. And I also would have liked to acknowledge my actual knowledge of the PA profession more. I felt like it felt weird for me to talk about my knowledge of the PA profession because I knew that I would be talking to actual PAs who already knew all that stuff. So I didn't want to talk about stuff that I already knew. But then again, it's about demonstrating your knowledge of the PA profession, not explaining to them what the PA profession is. But they also want to know that you know and you've done your research. So I would have liked to talk a little bit more about that. What I did like in my application is I use patient examples. Like, I don't think you should use a ton of patients, like patient stories that you've worked with, but I do think that you should put in like 1 or 3, or have at least 1, just to demonstrate that you have, communication skills, you have leadership skills, and you communicate with patients and you're compassionate. Another thing is I did like my patient care experience hours. I had about 1,500, which for an internal applicant who didn't take a gap year or anything is pretty on the high side. The average for my school is about 2,000, but that was weighed heavily by the external applicants who may have been working as RNs or anything like an ER tech for years prior to applying to PA school. Another thing I did like is I had a lot of shadowing hours, and it was varied from outpatient orthopedics, outpatient surgery, family medicine. So I had and then online shadowing hours. I had a lot of variation there. If you want to do online shadowing and you don't know like what organizations to use, I don't know how much longer it's going to be around with COVID cases going down and places opening back up. But on my website, prepaforum.com, I do have all the list of organizations that I used personally to online shadow. All you would do is look up that organization on like Instagram, find their website, and then they would show you how to sign up for the virtual shadowing hours. I was happy with my GPA. I was happy with my leadership experience and volunteering. The only thing I wasn't necessarily happy with was my GRE. It was still above average for my school and in general, but it was weighed down heavily by my math score. So my verbal score was in the 80th percentile. My math score was in the high 40%, which is below average. Now, what I would have liked to do is have taken pre-calculus and statistics beforehand. Now, there's not necessarily, calculus or statistics on the actual exam, but some of the equations you get, they would have helped on the exam. And I think I would have been able to score above average, or at least average, if I had taken those classes prior to taking the GRE, and that would have brought my score up, above a 310, which I would have liked. But I'm not going to retake the GRE. Just costs too much money. Another thing I would have liked is, as far as my patient care experience hours goes, I was satisfied with the quantity. I worked as a PTA. That's where the majority of my hours came from clinicals, and then working in a rehab hospital. I would have liked to get an EMT certification, or either work like in an ER, like an ER tech, or just work as a general EMT in the ambulance. But the certification would have taken too long, and for me to do that while going to college, it just wasn't something that was viable for me. I would have liked to did so in the past and became an EMT on top of maybe working as a PTA. It's easier to get hours as EMT because there's more availability, and most ambulance places aren't looking for just full-time people, whereas in PT they're looking for primarily full-time people. So that was something that was difficult for me, and that's a little bit about what I would change about my application. We went over how to apply to my interview, how I'm preparing for my PA school interview, and once again that should be in a few months. I'll do an update on that after I interview, and I want to thank you guys for watching. If you enjoyed, make sure to hit that like button. If you want to see more pre-PA content, a little bit about finance, fitness, all that, go ahead and subscribe to my YouTube channel, and I'll see you guys in the next one.